For XIONG, daily meal deliveries are the highlight of his day. The Wuhan resident has recovered from the coronavirus, but he has to stay quarantined at this hotel for 2 weeks. He says getting infected came as a surprise.
I almost had zero symptoms. I sneezed a few times and was drowsy for a few days. That's all. I always want to sleep, but I was never feeling too bad.
XIONG is considered asymptomatic, displaying few or no specific symptoms. His parents also caught the virus. His mother had a fever, but his father also had very few symptoms. After 2 weeks at a makeshift hospital, and without undergoing any treatment, XIONG tested negative for the illness. Former World Health Organization official Yu Pingdu says asymptomatic patients are not unusual.
We've seen that everywhere all over the world. These people test positive but show no symptoms. If we group them as patients after they tested positive, we'd have too many patients. They are not strictly patients, but rather virus carriers.
While the coronavirus can cause pneumonia and lead to other health complications, health officials say 80% of people who catch the coronavirus only have mild symptoms. Experts say this means asymptomatic patients may go untested and can spread the illness without knowing. But there is good news.
The good news is many people who don't show symptoms can develop immunity. If a lot of people develop this immunity, the epidemic eventually will slowly disappear.
Medical experts are still learning about the severity of the virus, but those over the age of 60 and with other underlying health concerns appear to be the worst affected. XIONG says his experience shows there's no need for people to be too alarmed.
It's a bad thing for the whole society, but as individuals, we don't all have to panic. For me, I didn't feel much. I had no fever. It was better than the cold.
With a week left in quarantine, he's looking forward to leaving the hotel and daily food deliveries behind. Katrina, Al Jazeera, Beijing.